Hi everyone, my name is Beth and thank you so much for joining me for this session on patient-doctor communication. So before we get into it, I just want to introduce myself. I live in the UK, just outside of London. I love taking my two beautiful golden retrievers for long walks. I love cooking, and I've been able to try out loads of really awesome new recipes during lockdown. And you know what? While I can't get dressed up and hit the town right now with all of my friends and go dancing, I am definitely whacking up the music in my kitchen most Friday nights and really going for it. But anyway, before I go into even more lockdown antics, let's get into today's presentation. So I'm 23 years old. I was born with a unilateral cleft lip and palate. I've had over 20 years of treatment, including 10 operations and well over a decade of wearing braces. While studying for my English degree, I learned about the dynamics of patient-doctor communication, and I wrote several papers about this and looking about healthcare interactions. Having been a patient since I was born, I understood firsthand the difference good communication can make, so I decided to specialise in this field. It was during this research that I reached a major milestone in my cleft treatment, which gave me the confidence to write my own website about my cleft journey. This website was then picked up by the CEO of SmileTrain, and after a few messages back and forth, we decided that I'd come to work for SmileTrain after I graduated, where I could use my experience to inspire our supporters and help them really understand the life-transforming work that SmileTrain completes every single day. Now I'm using my communication skills to help a UK medical charity to help and support others facing really difficult healthcare decisions. Okay, so for this talk, I'm going to very quickly cover my treatment timeline. Then we'll look at how patient-doctor communication comes into our cleft journeys, some of the issues with these interactions, and then some tools that we can use. We're going to finish up on how communication impacted my cleft journey, and then we're going to focus on some key takeaways that you guys can use in your appointments. So starting from my early years, I had my lip repaired when I was 3 months old, and then my palate repair when I was 9 months old. To help with my issues with fluid, I had grommets, or for those of you in America, tubes fitted when I was 2 years old and then again at 9. I don't know how many of you will be familiar with those excruciating moments of waiting for your eardrum to burst, but for me, they were kind of a staple of my childhood. The first appointment that I can remember is when I was 5, where I had my first dental impressions taken. Sadly, I remember this as not a very nice appointment, and I remember it so clearly because of my orthodontist. To take the impressions, he just shoved in the really horrible plate full of that really minging place, that really horrible paste. He just shoved it straight in, and I started choking, and I just felt like I was suffocating. You know, I was 5, and I had absolutely no idea what was going on, and you know, I started to cry, I got really upset, and it was just a really horrible experience, to which all he said was, "Stop crying, you silly girl." Now, it's pretty awful, but luckily, you know, my parents were there to soothe me. But, you know, if instead he said something like, "This really won't be very nice, just try and breathe through your nose and it'll be over before you know it," I'm pretty sure I wouldn't have felt quite so nervous when I found out a few years later that he would be the same orthodontist that would fit my 9-year-old braces. Luckily, over several years, we developed a pretty good understanding of each other. By the point that he actually retired, I actually cried to find out he retired. Not out of relief, because I was really sad that he was going to go, because we'd built up this really nice relationship over the 4 years that he treated me. And you know, this just really shows how good communication can really make or break our relationships with our healthcare professionals, and it can really work wonders in establishing trust. So after my grommets or tubes, I had my wire brace fitted, which helped prepare my mouth for my alveolar bone graft when it was just before my 10th birthday. So I was still 9, it was about a month before I turned 10. During this procedure, a bit of bone was taken from my hip and it was put to fill a hole in my palate. After this procedure, I had a false tooth on a retainer to fill in the gap where no tooth had grown because of my cleft. During my middle years, I continued to wear this retainer, and when I was 16, I had train track braces fitted to correct my teeth alignment. While this period is pretty quiet for treatment, these years were the hardest for living with my cleft. From about the age of 10, I knew I looked different and became incredibly self-conscious, and I developed really, really low self-esteem. I was terrified that people would judge me before they'd had the chance to get to know me, that they would be put off by my complicated exterior. I mean, when you're a teenager, we all feel pressures from all of these amazing, perfect images that we're seeing all the time. But for someone born with a cleft, when you feel that low about the way that you look, it's just really, really hard. And actually, to put it bluntly, I don't think it's any exaggeration to say that I hated myself because of my cleft. And it just felt so unfair to me that most people can hide their insecurities, whereas I had to show mine 24/7. I couldn't keep it private because it was literally my face. So these are the feelings that drove me to want to have my laser treatment. And the key for me was having treatment to transform my nose. As you can see from the pic on this slide, my nose was very flat and it was collapsed on one side. To me, having my nose sorted was the key to improving my self-esteem. I therefore spoke to my medical team to learn about what we could do about my nose to help me with my insecurities. To sort my nose, I'd need to have jaw surgery so that my top jaw, which used to sit behind my bottom jaw here, by having jaw surgery, it would move my top jaw forward, and then that would provide a much better foundation for them to be able to build my nose. In preparation for my jaw surgery, my medical team could see that my wisdom teeth could cause some problems if they came through, so I had them removed. Unfortunately, my jaw surgery didn't heal properly the first time around. I want to stress right now that this is so incredibly rare, so I don't want that to cause any alarm to anyone. However, it's part of my cleft treatment and it's part of my treatment timeline. So to correct the issue with the first jaw surgery, I had more orthodontic devices and retainers fitted, but in the end, we decided to redo the jaw surgery, this time with a bone graft, so it would help the jaw structure heal and to really encourage bone growth, which had been the issue the first time around. From there, I had my nose surgery and I had my nose reconstructed. This was the moment that my life was utterly transformed. After my nose surgery, I could see myself clearly. I mean, you can probably all see here, my nose is not what you might see in Vogue or some amazing Photoshop piece of modelling. It's not symmetrical, it's not perfect, but to me, it really is. I can't get over how much I love my nose. I just think it's great, and I can't tell you how much, the change. I thought the change was more about my physical change, but actually it was about a monumental shift in my psychology, in the way that I felt about myself, the way that I saw myself, the way that I felt every time I looked in the mirror. And actually, having my nose surgery is the exact reason why I'm here talking to you guys today. It allowed me to really feel proud of myself, really feel proud of my cleft, really own my cleft as an awesome part of my identity. You know, where I'd shied away from it before, now you know, I just want to talk to everyone really about my cleft, and I just think it's a really brilliant thing to be proud of. So after my nose surgery, I then chose to have my lip reconstructed, and from there I had a permanent false tooth fitted on a bridge, which is the false tooth that I'm still wearing today. It is that one there. If you could see that, you've got brilliant eyesight. So that's quite a long journey, and really that's just the highlights. I'm so grateful to the amazing medical team that got me to where I am today. But, you know, who are these amazing medical professionals? You know, I've spoken to countless surgeons, hearing specialists, psychologists, nurses, orthodontists, speech therapists, all at different levels of seniority, all at different points of my treatment. You know, some I've known for you know, over a decade, and others I've met once or twice in a quick 10-minute appointment. You know, cleft treatment can span your entire childhood, teenage years, and then into early adulthood. And anything can happen in a couple of decades. You know, the team who treated me as a baby were all retired by the time I was a teenager. You know, we moved house when I was little, and we changed the hospital where I'd received treatment. So, you know, that meant, again, I had to get used to talking to a whole new set of people. It's a lot of people to talk to and trust, especially as you grow up and start to make more treatment decisions. This is where we're going to look at patient-doctor communication. First of all, let's look at why patient-doctor communication is different to a regular conversation. Firstly, there's usually a knowledge gap between the patient and the doctor. You don't know what's wrong, but the doctor probably does. You know, they know what can cause us problems, and they know ways that they can heal us. Usually in a conversation with friends or family, we can always change the topic to something that we have more understanding about or more knowledge, and we can contribute our own understanding to the conversation. In patient-doctor conversations, it can feel like the doctor holds all the cards and they know all the answers. Secondly, there's a health gap. A patient is more vulnerable than the doctor because we're unwell in some way, and we're showing or telling the doctor about this vulnerability openly. With a friend, they might discuss their own vulnerability with us, so we don't feel quite so self-conscious. In a patient-doctor conversation, doctors do not tell us about their own vulnerabilities, unless it's so that, you know, we feel better about our own concerns, rather than so that they tell us so that we can help them and fix them. In patient-doctor conversations, there is an expectation that you will immediately tell your deepest concerns to someone you may have only met once or twice, and you're expected to trust them purely because of their job title, rather than because you've had time to get to know them and you've built up that trust like you would with your family or like you would with your friends. This again can make it really quite hard to talk to them. I mean, equally, it might mean we're more honest because we don't need to see our doctors in our personal lives. To me, it's all about establishing that trust and having the confidence to share our concerns. Finally, time restrictions. These can cause lots of problems. Often we may feel like we're taking too long, or we may feel pressure and might decide to rush through our concerns, or, you know, pretend that we understand something that still makes no sense, which can leave us finishing the appointment feeling unsatisfied or even scared and confused. So how can we overcome these inherent difficulties? I believe that this supposedly unequal interaction of, you know, high and mighty doctor with all the knowledge and all the cards versus a patient who is vulnerable and passive can be evened out with a change in perspective and is all reliant on good communication. This can be done by seeing the conversation as an equal exchange of information, where you both have something to offer as active participants. so that we as patients feel empowered to talk to our doctors openly. Knowing this is in both the doctors and our own best interests. If we can openly give our symptom information, doctors can better understand the issue and provide a better diagnosis or treatment plan. This is incredibly important for us as cleft patients, where, as you can see from my personal treatment timeline, our symptoms can come from our feelings as much as any physical concern. My symptom information that I had to give was to tell my doctors that my nose made me horribly self-conscious and it made me have terrible self-esteem, and that I wanted to know how to fix this. In turn, they could tell me about the procedures needed to reconstruct my nose and give me the best treatment outcome. But this shift in power to make the interaction more equal relies on us talking to our doctors as equals and as active participants in our medical journeys and conversations. When we as patients understand our treatment plans, we know what we need to do on our side to make sure that the doctor's treatment plan is a success. So this all sounds great in theory, but we literally just looked at why a patient-doctor conversation can be quite tricky and why it can feel quite difficult to talk in these situations. You know, whether that's our, time restrictions, whether that's the trust in the relationship, the health and knowledge gaps, there's loads of reasons that these interactions are that little bit harder. So how do we overcome this and create these empowered, more equal conversations where we're working on a teamwork style of communication, where we all have something crucial to offer to be able to reach that best treatment outcome? Firstly, your mindset. Remembering that you have a lot to offer can really help build your confidence to tell doctors that extra information that will help them find the best treatment outcome for you. One of the many things you have to offer is the fact that despite all their years of expertise and education, you know your body better than they do. It can feel like they know more than you when they're planning these amazing, impressive operations and they're using a load of Latin phrases in your notes, but they can't feel what you're feeling. I remember many times telling my orthodontist where I could feel a really sore area in my mouth. At the very least, she'd have a look and could reassure me, actually, it was all okay, but, maybe keep an eye on it. Or at the most, they might see where the wire was really digging into my gum and they could sort it out, which, could mean that we can avoid things like maybe an infection or, an inflamed gum. And together, because I'd shared that extra bit of information, which maybe they might have missed, we were able to reach that better treatment outcome. So beyond knowing your body, you know what's important in your life and what's going on. Cleft treatment can span decades and you can't put your life on hold. You need to tell your doctors if you don't want treatment at some point. It's totally fair enough. Maybe due to work or school, it can mean some time off. And if you don't want to be doing it at that point, you need to tell your doctors, as it will impact your treatment plan. And it's that extra bit of information that they need to consider and they need to factor into their plans when they're deciding what's best for you. Sometimes we can't control every part of our treatment. For example, you all know that my nose was my biggest concern, and I remember feeling so upset that the doctors wouldn't operate on it and just sort it out straight away. While the situation was by no means ideal, my doctors explained that they didn't want to keep putting me through operations through school, and that I would have less scar tissue if I waited. While it still hurt to be told, you're just too young and you have to wait, it really did help to understand the reasons behind needing to wait. And their explanations eased some of my concerns, which, were effectively part of my symptom information. We can see the differences in patient-doctor interactions stem from the fact that you're talking to that person because they know more and can do more than you to help you. That is brilliant, but it can also be a bit intimidating. Remembering that no one expects you to know about this stuff can actually be really reassuring and empowering. Understanding your treatment can help ensure its success. Not understanding it, I believe, is part of our symptom information. It's a problem that should be addressed. You absolutely deserve to know what's going on. And if you know what's going on, as I said earlier, you can help your doctors and ensure that your treatment plan succeeds. This does mean asking a silly question or a scary one or an obvious one. I promise you that none of these questions will make you look silly or dumb or clueless. Asking questions will show that you care about your treatment and that your doctor simply need to explain something in a way that helps you understand. For example, when I'd had my jaw surgery, I had to wear really complicated elastics that held my jaw together. If when my doctor asked me if I knew where to put the elastics on my brace, I'd lied and said, oh yeah, I completely understand, I may have actually gone home and then completely mucked up their treatment plan because I was too concerned about looking silly or feeling rushed to ask them to show me. Instead, I explained, I wasn't sure, and they drew out a diagram for me. Being honest about this was effectively part of my symptom information, as it's something my doctors needed to know. And it meant that they could address it and ensure that the treatment was a success. Ultimately, everyone is there to help you. They all want you to feel empowered, to ask those questions, share your concerns, and ask for guidance. So we know that these conversations can feel a bit daunting. To help voice our words, I would strongly recommend writing down your questions and concerns. Try and write them down as you think of them. You can store them up for when you next see your team, rather than feeling the pressure of the conversation where your mind might go blank. I would often make notes, or my dad would, during the appointment, which would help me afterwards when I might write down a few extra things that the doctors had said. This takes the pressure off that one interaction. You don't need to understand everything in that moment, and you don't need to think of everything in one go if you have it written down to prompt you. It also helps you then if in the future you want to refer back and you want to think, oh yeah, where am I? What's coming up next? Because there's quite a lot to think about within cleft treatment. I also found it useful if I felt like I was taking up a doctor's time. I would tell my doctor I have, 5 questions that I'd like to get through. This would mean that they know what to expect, and they would know that I would want to get through all of them, rather than if I'd asked maybe 1 or 2, and then if I felt too rushed or like I was taking up too much time, and I might have decided, oh, I can't ask the others, I'll just skip those. By telling them how many I wanted to at least ask them, it meant that I made sure I got all the answers I needed. It would also help me feel like I wasn't stumbling over my words quite as much. I knew that I didn't know all the special technical terms, so admitting that when I wrote the question down really made me feel better when I said it in an appointment. I might even use a silly or made-up word to help me refer to something. I owned that I didn't know what the right word was, but I didn't let it stop me from asking that question and trying to communicate to my doctor where I was referring to. Doctors can pretty much work out what you're referring to. That tooth right in the back, that big flat one, I don't need to feel bad or silly that I don't know that it's called a molar. They can pretty much work out what I'm trying to refer to. And the point is, it hurt. So I needed to tell my doctor so that they could take that second look and see what was going on. So I've said what you need to do, but you don't have to go through any of this alone. There's always someone there to support you, whether that's a parent, a guardian, a friend, or other family member. Take someone with you. As I said earlier, my dad took all the notes for me, and it really helped to have his support. You can also speak to the team psychologist. I've spoken a lot about asking questions, but sometimes this is really hard. For whatever reason, if you feel embarrassed or scared, a psychologist can help you feel more comfortable. I had some treatment complications with my first jaw surgery, and I felt really scared at this point. The bone hadn't healed, and I was in a lot of pain. I had many concerns about my treatment, but it was really hard for me to talk to my surgeon. On the one hand, I really liked her, but then on the other, she'd completed my first jaw surgery, which had essentially failed. And now she was proposing that we do it all over again. I didn't know how to tell her that I was scared that it would fail again and that I couldn't see how the new procedure would be any different. Saying this directly to her was really, really hard. So I decided to sit down with a team psychologist and with her, and together I was able to voice my concerns. Sometimes I would ask a question, sometimes I would have spoken to the psychologist beforehand, and they might help sort of phrase things for me or direct the conversation to make sure that all of my concerns were addressed. And in doing this, it meant that I was able to rebuild that trust in my team, and I understood how having a bone graft the second time was hopefully going to create that successful treatment outcome, which it did. So how do these tools fit into my cleft treatment? As we've seen, my treatment absolutely transformed my self-esteem through my nose surgery. And even when things went wrong along the way, through good communication, I was able to get the information I needed, which helped me understand my treatment, build trust in my team, and ultimately make the decisions that I needed to be able to get the best treatment outcome for me. And, at the end of the day, by using those tools, thinking about how do I give the best symptom information to help my doctors help me, it means that I've now got to this point where I'm speaking openly about my cleft. I'm owning it as this brilliant part of my identity. And that's why I really wanted to share my passion for good patient-doctor communication with you all today. As you can see, it can have the power to transform your life. So, some key takeaways for all of you. Firstly, give your doctors the best symptom information possible. You know your body, you know yourself. Tell them what's important to you, what you're worried about. Give them as much help as possible to give you the best treatment outcome. Ask questions. Your treatment is happening to you. You deserve to understand every part of it. Use support, whether it's friends, family, team psychologists like those that are here today. You don't have to do any of this on your own. Take notes. Seriously, it will help. If you can't take them, ask someone else to. And finally, you know yourself. You're awesome, you're brave, and I want you to be confident and empowered in your patient-doctor conversations. You have so much to offer, and you deserve to get the best treatment possible. Thank you so much for joining me for my session.
We hope you enjoyed this session. Please take the remaining time to visit our expo booth, get your portrait drawn, visit our video booth, or find an open discussion room. Share your smile. Post on social and tag @SmileTrain using #CleftCon.